All right, so I have wonderful news. Okay, this is actually breaking news. Possible cure for pancreatic cancer, but I don't want I don't want to get ahead of myself. Okay, let me explain. This has not been done in humans yet, only in the lab. But this is definitely promising. Promising. So if you look here, it says new triple drug treatment stops pancreatic cancer in its tracks, and mouse study finds. So this was done in mice. Okay, so not humans yet, but now it's going to the phase two trial. Okay, phase two part of the trial. So let's see what it says. By targeting three key growth factors, sorry, by targeting three key growth pathways at once, researchers eliminated the pancreatic tumors in multiple mouse models and prevented the cancer from returning. A promising step towards overcoming treatment resistance. This is big, y'all. So these researchers found out that it's going to take three drugs administered at different part of the cycle to eliminate pancreatic cancer. Now, if this works in humans, you don't understand how big this is. How big this is. It really is. Um, Pancreatic cancer is one of those cancers that, unfortunately, not too many people make it. Like 5 or 6% of people live to year 5 after diagnosis, and it could be, causes could be genetics, smoking, excessive drinking, but this is a very, very devastating cancer. So, this research, this article that's on Life Science Plus states that a triple drug therapy for pancreatic cancer has shown promise in early animal tests, pointing to a potential new treatment for a disease with a notoriously low survival rate. This is, and then it goes on to say, considered one of the deadliest common cancers. Pancreatic cancer has a 5-year relative survival rate of around 30%. So it's around 30% survival rate after 5 years. So just so you know, the way they judge to see if somebody is cancer free, they go by the 5-year mark after diagnosis. So they're saying that the survival rate, at 5 years is around 13% for pancreatic cancer. That is low. That is low. Meaning roughly, check this out, roughly 87% of people with the cancer are expected to die within 5 years of diagnosis. That survival rate can plummet as low as 1% for people diagnosed in very late stages of the disease. So you have an idea how deadly this cancer is. Steve Jobs died from pancreatic cancer. So this study was published December 2nd in PNAS, where researchers tested a new combination of therapy that blocks three cancer growth pathways simultaneously and shows promising results in mice. For those we use mice subjects because mice reproduce quickly, and mice anatomy is pretty much like ours, believe it or not. So some people don't want to believe that, but humans and mice biology are pretty similar. So these studies open a path to designing new combination therapies that can improve survival for patients with pancreatic ductal adenocarcinoma, the most common pancreatic cancer. The study authors said in a statement, quote, "These results point the way for developing new clinical trials." This is big. This is big. Early stage pancreatic cancer grows silently inside the abdomen without any obvious symptoms. That's the thing about these cancers, is that once diagnosed, it's pretty much at the later stage. Because listen, early stage pancreatic cancer grows silently inside, it goes silently inside the abdomen without any obvious symptoms. By the time the disease is detected, it has often already spread to other organs, making it difficult to remove surgically. That's one of the biggest problems about pancreatic cancer, is that it tends to be diagnosed later instead of early. So the standard treatments are like chemotherapy that attack all rapidly divided cells in the body. Just so you know how chemotherapy works. So chemotherapy targets cells in our body that divides rapidly. That's why people lose hair sometimes or have digestive issues, because hair cells and digestive cells tend to reproduce rapidly. So that's why those are some of the side effects of chemotherapy. okay, often causing a lot of collateral damage in the process of controlling tumor growth. And even then, tumors usually find alternative ways. So the problem with cancer cells is that they adapt very well to change, to drugs, to medication, to everything, especially pancreatic cancer cells, tumor cells. So this new therapy not only prevented the rodent's cancer from coming back, but it was also non-toxic for mice overall, showing no debilitating side effects. That is key. That is key. I'm gonna say it again. The new therapy not only prevented the rodent's cancer from coming back, but it also was non-toxic for mice overall, showing no debilitating side effects. That is big. That is big because anytime we introduce a new drug, we definitely want to minimize the side effects that the drug can potentially have on people. Okay. Nearly all pancreatic cancers are associated with a mutation in a gene called KRAS, K-R-A-S, which normally controls cell division and growth, keeping it in check. But when the gene is mutated, it gets stuck in an on position, leading to an abnormal rate of cell division and cancer. Prior to the current research, senior study author Carmen Guerra, a cancer biologist at the Experimental Oncology Group of the Spanish National Cancer Research Center, developed mouse models to investigate how KRAS mutations and other related pathways help pancreatic tumors survive. Now, when you break down health illness in general, not just cancer, but just all types of health disease, most of the time it comes down to inflammation of certain parts of the body. We all heard that word before, inflammation. Most of us are in chronic inflammation. Chronic inflammation can lead to cancer, can lead to diabetes, can lead to all types of health conditions. But as an acupuncture physician, there's certain points that can actually help you control the inflammation, help you bring it down. Research-backed study of acupuncture points shows that certain points like LI11, the acupuncture point at the crease of the elbow, called large intestinal 11 or LI11. This is a great point to bring down inflammation, especially in the upper body. Stomach 36, which is right below your knee, lateral to your tibial bone, that point is good for inflammation throughout the whole body. Well, so basically, what I'm getting at is, thanks to this new study, there's hope for people with pancreatic cancer or who develop it in the future. Again, this study is going to the phase 2, and this study has not been tested, or this drug has not been tested. Sorry, these 3 drugs have not been tested in humans yet. They're still using mouse studies, but it looks promising so far. It really does. I'm very, very excited because this could help a lot of people out. A lot of people. Okay, so basically, the takeaway from this video is that there's no cure yet for pancreatic cancer. There's no cure yet. But early research shows that, at least in mice, it seems to work with minimal side effects. Of course, I'm going to keep you updated about this. Breaking news. I think this is awesome. If you have any questions below, please leave it below. If you have any questions, please leave it below. And then I'll talk to you later, okay? Thanks for listening, y'all.